The two biggest mistakes are A, they shop on premium. That's the flat out the clearest one. Then the next one is they don't check the plan that they're looking at's network. Very few people have all their doctors or clinics in the same network anymore. And what will end up happening is they see the first doctor that they kind of see the most is in network, but the one they see the second most, usually the specialist, is the one that's not in network, which leads to greater out of network, expenses, which is always the shocker when we get that bill because we have to pay that. It's really just kind of being network aware. The other thing is, and it's not as important because it usually jumps out at you, is what the max out of pocket is. The lower the premium you pay, the higher max out of pocket.
Welcome to the Healthy and Wealthy Retirement, where your certified retirement counselor, Mark Struthers, takes a holistic approach to retirement, going beyond finances and embracing holistic well-being. This YouTube channel will address not just the financial part of retirement, but also the social, the physical, and the emotional parts of retirement. Everything you need for healthier, a wealthier, and a happier retirement.
Welcome to the Healthy and Wealthy Retirement. My name is Mark Struthers, and I'm excited you're here. And you will be glad that you are here as well. Not just if you're in or nearing retirement, but if you're someone who likes healthcare. We often cover things that are non-financial related, the wellness part, the health part, being intentional about how we go into retirement and how we live retirement, as far as the social, the emotional, and the physical, about staying active to make the most of your retirement. A big part of that is healthcare. And one of the major shifts that's happened recently, and there's a lot of confusion about it, I get all kinds of questions that I am not equipped to answer, is about the big, beautiful bill. And we're not here to take sides you might not like. You might not consider it beautiful. You might, that's up to you. But with the end of the Inflation Reduction Act, major changes are on the horizon. We have to deal with what's in front of us. We have to deal with the environment we're in. Service areas are shifting. Advanced premium tax credits may be going away. Medicare, which is very important for almost everyone, Medicaid, and here in Minnesota, Minnesota Care are all being reshaped. To help us make the best of it, the most of it, to deal with what we have in front of us is Matt 𝐷𝐿𝐼, Operations and Sales Manager at 𝐼𝐭𝐭 Capital Group. Matt has nearly 30 years of experience, including guiding individuals, families, and retirees through financial services and health insurance. He even launched the first Minnesota individual health insurance quoting engine back in 2009. If I'm talking fast, it's because I have a lot of resume to get in here. He specializes in Medicare and retirement-focused healthcare and giving clients clarity in a system that often feels overwhelming. My son recently had a broken neck. He's fine, but dealing with the system and the stress and the emotion is challenging. Matt is also a Series 65 and has his insurance and life insurance licenses. Matt, did I miss anything? Welcome.
You did not, other than the minor detail of missing my health license. I think the state of Minnesota would be glad to know that I'm current and up to date on my health license. So what I'm talking about is not just made up stuff.
Sorry about that. Thank you for getting that in. No, you don't want to run afoul of state compliance. We never do that. There was just a lot to read. So in your own words, tell us, what do you do and why do you do it?
What I do primarily is I work with folks, two factions of folks. I work with the early retirees, age 55 and up. And then I also work with small business owners that might not be 50 and up, because sometimes small business owners don't have access to traditional health insurance. Why do I do it? Why do we do anything in these industries, right? Generally speaking, I want to help people. I started my financial services career back in the late 90s, mid 90s in product development and rollout for broker dealers. I helped build RIA platforms for some of those broker dealers here in the Minneapolis area. But my focus kind of switched in 2006 when our youngest daughter was born with a mild form of spina bifida. We spent 11 months at Children's Hospital and did 9 surgeries in those 11 months. And while we were there, a couple next to us in the ICU, their son was born with a hole in his heart. And they had no health insurance at the time. And to think that you would have to have open heart surgery for a newborn and have no health insurance, to listen to them and to hear them as they had to mortgage their family's farms in order to cover this insurance or this medical need, it became sort of there has to be a better way to communicate and help people prepare for the worst. And so I decided to kind of focus my energies in shifting in education and what I call health development. How do we get to a better spot without having to work very hard? So I started to shift away from corporate world and went out on my own. And with the help of a friend, we decided that working in the individual health insurance quoting engine would be the way to go.
Wow, what a story. Yeah, that must have been heartbreaking. It's always interesting to hear people's kind of the catalyst or the often an emotional why they made a shift one way or the other.
Yeah, it was for me because, as I said, with our daughter being in Children's Hospital for as long as she was, we had health insurance. We had it through an employer. We had sort of how Americans have been getting their health insurance since 1942, right? When we had wage freezes back during World War II, the only way you could get people to come work for you was, we can't give you more pay, but we could give you a benefit. So we never really had to worry about whether our bills were going to be covered, whether we were going to be able to get sort of, I won't say the care that we deserved, but the care that was the best available to us. And it's hard. I mean, everybody gets an explanation of benefit, or they have a story or a friend that somehow insurance didn't work. And knowing on the financial services side, being the financial advisor is the easy part because you only talk about the up. Nobody ever calls their financial advisor when everything's going well, right? Yep. Same thing holds true for insurance. Nobody ever calls me when their health insurance is going great. It's always the uh-oh moment, right? What happened, or why did this go wrong?
Yeah, it's in the background. You take it for granted. And what I find curious about your story and about health insurance is, and it's a little bit like estate planning, you're dealing with all these complexities. At the same time, you have something really stressful going on. In the case of a newborn or your daughter, you have a lot of things that are weighing on you. At the same time, you're having to worry about these life-changing bills.
Absolutely. And one of the things that was always intriguing to me in building the RAA platforms was that a lot of financial planning softwares don't include medical expenses or long-term medical expenses. In my household, we have the mild form of spina bifida, but I also have a type 1 diabetic. And prior to 2014, those were auto declines. We couldn't get health insurance if one of us wasn't employed. What do small business owners do?
Yeah.
I always generally say to people, I don't mind if you smoke, drink, or ride motorcycles without a helmet. The hard part is that those are conscious decisions in most cases. Being born with a hole in your heart or spina bifida or type 1 diabetes, that you had no choice in that, and you shouldn't be penalized for that, right? And so it became sort of this philosophical change for me is, how do I educate people? I always wanted to be a school teacher. I just had no classroom control, I was told. So let's get out into the real world and see how we
Me either. Thank you, Matt. That was great. But I think most folks who are turning in have one main question, and that is, Matt, are you down with OBBB?
The answer to the question is maybe. How's that?
Well, I was looking for, you know me, but...
Yeah, you know me. I guess I should know better.
That's mainly why we're here. So tell us about the big, beautiful bill. What is it? What are your thoughts? Rather, what are the biggest things that clients should know about right now?
Well, with the OBB, what I can speak to is my compliance officer would say, please leave the tax part alone because you're not a tax expert. So we'll stick strictly to the healthcare. It is worded in the bill that there is supposed to be no cuts to Medicaid and Medicare and what we would call traditionally our social safety nets. And that's not necessarily true. I cannot say for certain that that is a true or untrue statement, because even this morning I was getting legislative updates because nobody really seems to know specifically what is going to be affected. What we do know that there are cuts to Medicare and Medicaid. Then what they mean by cuts is reimbursement. And what a lot of people don't realize, especially in the Medicare space, there is no negotiation for services rendered. And what does that mean? We'll use my daughter as the example. The first month that we spent in the ICU, the hospital room was $1.2 million just for the room. That wasn't surgeries, doctors, anything like that. Okay.
Wow.
So in that case, the insurance we had at the time, our insurance company negotiated with the hospital what they were going to pay for that. And it becomes a negotiation. And obviously, if this insurance company has more heads on the books, they get to negotiate a better rate. In the Medicare space, there is no negotiation. What happens is Medicare says we will pay you X for said service, whatever it is, the room. The hospital, doctor, or clinic, or whatever will then say yes or no. If they say no, then Medicare says, okay, that's fine, but you no longer can take any more Medicare patients and receive no more Medicare payments. It's sort of all or nothing. Okay. Now, the best part of all of this story is that for the last 4 years, the largest class of baby boomers have been aging into Medicare. And we have 4 more years of the largest class of baby boomers aging in, which might not surprise the financial planners. Obviously, the largest conglomerate of wealth is in this class of baby boomers. So we're not necessarily dealing with apples to apples, but when we talk about the big beautiful bill, it's the reduction in the reimbursements and funding that hospitals, doctors, and clinics will use to underwrite those discounted costs. And discount's not the right word to use, but it's the word the description that would work best in people's minds when trying to understand the big beautiful bill.
And what does that mean for those that are on Medicare?
Well, for right now, for those in Medicare, what we're really kind of waiting to see coming into 2026 is what is going to happen, to pricing for plans, okay, particularly in the Medicare Advantage plan space. And for here in Minnesota and primarily the Midwest, if we really want to kind of expand in North Dakota, South Dakota, Minnesota, Wisconsin, and Iowa, Advantage plans are, I want to say, relatively new to the market. 2019 in Minnesota, particularly, we had a Medicare law change that allowed for-profit carriers to move into Minnesota. Examples would be United Healthcare, Cigna, Aetna, and Humana were able to sell Advantage plans in Minnesota. Prior to that, we were a non-for-profit only for health insurance sales. Thus, the reason why it was interesting to have United Healthcare's corporate headquarters here in Minneapolis, but you couldn't get a plan or a product of theirs because it wasn't legal. So 2019, we saw a large influx of Medicare Advantage plans. And so we're waiting to sort of see what the pricing will look like, because Advantage plans rely on reimbursement and the money flow from the federal government. And some of the areas that we're going to see that are really going to be affected are outside of the metro area, outside of what we would call the 494, 694 loop for those of you in the metro or Minnesota that know it. If you're not there, anything kind of south and north.
Yeah, for those of you not in Minnesota, we have like a little square that surrounds the St. Paul, Minneapolis area.
Yeah, and that's the key. How does it affect? What we don't know is we do know that, for example, in southern Minnesota and northern Minnesota near the Iron Range, we are starting to see Advantage plans exit the market because of many things, including it's hard to get service when you're in a rural area. And that is, again, sort of an adverse effect of this big, beautiful bill, is that there is conversation and statistical evidence that's leading us to believe that the rural communities are going to lose services or providers of services. And that again is something to look at overall of a financial plan is if I have to drive 2 hours to get to where I need to be, or do I move if I can move? Or
Yeah.
do I have to look at different types of health insurance plans? They're not advantage plans to help get me covered that can be more cost ineffective, especially in a cooling economy. I think most of us would say is probably on the horizon.
So you could have insurance at deserts. I don't know if that's too strong a word, where they might have to do scenario analysis, which is kind of what financial plan is, to say, can I afford this? Or what's the benefit of moving to where you can get health insurance? A lot of times people take jobs for the health insurance, kind of like you alluded to. Could you see something like that?
Yeah. Oh, yes. I mean, that again is, we could see something like that, or more importantly, which is the most frightening thing is that we'll just end up seeing people leave health insurance as a whole. They'll just go uninsured. And
Wow.
those are the things that what people don't realize is, not having health insurance because I don't go to the doctor a whole lot or I'm not there. What they don't realize is that when you end up having to go to the doctor or to the emergency room, that somebody pays that bill, whether you end up paying it or not. And I don't have statistics, and it's something I can't get into deeply, but if you're looking at bankruptcies, it is medical bankruptcy that is ever rising, year to year to year, is that's what's causing it. And without affordable insurance, which we're losing or looking at the lack of it because of the big, beautiful bill and the loss of the Inflation Reduction Act, we might have pockets of our state or of our region that just are underinsured.
Wow. And is it safe to say that if you put off going to the doctor because you don't have insurance, that you end up with a lot worse problem? You simply kick the can down the road, kind of like one really big RMD from an IRA, where all of a sudden, instead of addressing things gradually, you get really sick really fast to where the bill is even larger than it would have been?
Yes. Oh, absolutely. I mean, it like you say in the RMD, or as I like to say, the car is when my children got their first car and they forget to change the oil, right? Because $59 was too much to change oil. The $4,900 repair on the gasket that was blown, it's a similar story. Yes, it is. And it's something that we try to look at. That's why in most health insurance plans, your preventative, your immunizations, and your primary care doctor visits are at no cost to you. The insurance company is incentivizing you as best they can to get you there, so it does save them money in the long run, which also reduces premium. Because again, if you're uninsured and you end up in the emergency room, somebody's paying for it, whether it's the county, the state, the federal government, and our increased premiums.
So your analogy is much better than mine, just because it's kind of financial plan wonky. But you're right. So if my boys ignore the lights on the car, they're going to save some money in the short term, but it's going to be a lot more expensive when things really go bad.
Yes, absolutely.
And it sounds like Medicaid is probably kind of what picks it up, or the hospitals end up paying the bill?
Well, the hospitals will end up paying for it eventually. They'll be chasing you down as the consumer to figure out how you're going to pay for it. But they have their stop gaps in regards to whether they go to state for funding or they go to the counties, because health insurance premiums are based on the county that you live in. Most people don't realize that. And
no, I did not.
The reason why for that is you're looking at how easy is it for you to get service. So if you live in downtown Minneapolis or in a suburb of Minneapolis, you can kind of, spit in every direction and find a doctor, a hospital, or a clinic. But when you get out into the rural areas, again, you have to travel. It's not as easy to get service. So generally speaking, your premiums are according, and your co-pays and your max out-of-pockets are based on ease of service, it's called.
Wow. I got to admit, if you're not in the metro area, that's a little scary.
Yes. Oh, absolutely. But that again is looking at the big, beautiful bill. It's how do we get people the health care that they deserve and should have in order to keep us healthy, long living, and a community. And if we're closing down plans, we're pulling doctors, we're pulling hospitals or funding. Where do we go from here? That's the question we all have to ask ourselves.
Might be one of those things that looks good initially, but longer term could have unintended consequences.
Correct.
We have a lot of clients that we plan their income often around the advanced premium tax credits. Does the OBBB, does that have any impact on that you're aware of?
It does slightly. The OBB will affect those that qualify for Minnesota Care, Medicaid, and in Minnesota, what we call medical assistance or MA. What it does is it absolutely forces people to fill out more paperwork, to do more, administrative things, right? And in Minnesota, particularly, you only have to do it annually, and you usually do that through MNsure, or you do it through a letter that's mailed to them if they're already on it. You just kind of check the boxes and get everything back. Now we're looking at least at the federal level, we don't have clarification yet from the state of Minnesota. At bare minimum, that will be every 6 months, but there have been rumblings that it might be every quarter. And if you can imagine, your neighbor who might be 73 years old, or even worse, might be 58 years old and not qualified for Medicare yet, that they have to do all this paperwork. It gets hard. And one of the things that, we're trying to get our heads around is that myself particularly, I'm getting to the point where not only am I taking care of my kids, but my parents are aging, right? And we're sort of that sandwich generation, and trying to manage kids and trying to manage yourself and trying to manage your parents, and to put more red tape on it, that just means people are going to walk away, right? It's just too hard.
Yeah.
I'll go
too much.
Yeah.
Yeah, my folks passed somewhat recently, and to have two boys of my own, and then the stuff we had to deal with their couple years of long-term care, I walked away. It was eye-opening because you don't really appreciate it until you have all the stress and red tape. But it was just surreal to think that people could go through that by themselves. The idea that my parents, who were not of sound mind, would have to rely on other people and companies to do the right thing was scary.
Yeah, exactly. And that's sort of my desire, my passion, my role is to help people walk through that. When you talk to people and you're talking about a financial or estate plan or doing an overall financial plan, you have to ask the tough questions, right? Do you have a will? Do you have a trust? Do you have powers of attorney? Do you have these things in place? Because we want to do it now. So when the stress level's through the roof, that we know everything's taken care of and we can focus on the things that we need to focus. That's sort of my position, and the reason why I'm in the business that I'm in is that people just don't realize the older we get sicker quicker, and it takes us longer to get healthier, right?
Yep, I hear you.
And so if I can meet with clients, or we can get in front of people to say, if we can at least answer A, B, and C, at least 80% of the lifting is done, and you don't have to worry about anything. That's the whole role of a financial plan, right? Is the heavy lifting is done. Obviously, there's going to be tweaks because the world changes, but financial plans don't necessarily include that, my Medicare Advantage plan has a $2,800 max out of pocket, but my estimated out of pocket expense for my prescription drugs every year is going to be $3,000, right? Those are things that aren't built into a financial plan. That's sort of my vision of my role. And when I'm looking at early retirees, especially those that work for school districts or municipalities or even large businesses, we're going to envelop this cost and financial plan. We're going to move away from our group plan to have an individual and family plan. Rules are there to help us. How can we take advantage of premium tax credits? How can we take advantage of these systems to reduce our expenses? I have the ability to give any client a number. They can take it to their financial advisor and their tax person if they have them, to say, how do we take advantage of the tax credits if they're available? Can we do that? can we reduce our income to get down to a level that says, yeah, we can do this and be maybe a little better off rather than having to pay more than we should.
Oh, yeah, well put. Yeah, and like you said, we have to acknowledge the reality in front of us. The rules are there. Take advantage of them. And that's where having professional help, because you don't know what you don't know, and no financial plan is perfect. But if you can do 80% the heavy lifting, you put yourself in a better position to succeed and handle those costs.
Yeah, flexibility is the key to everything because, again, like I said earlier, when we're talking about insurance, that means something bad happened. You never talk about insurance when things are going well. Can't emphasize that point enough. That's why I have thick skin. I get used to it. Don't worry.
Yeah, it's funny. My boys usually call me when something's gone wrong with the car, not when it's working really well. So, of course, Minnesota can do things differently, but how will those APTCs, and we all love acronyms in this industry, but the advanced premium tax credits, how will those be changing? What tips do you have for folks for how they can plan for those?
Well, what we're looking at right now is at least early indications are once the Inflation Reduction Act ends on January 31st of 2025, we are looking at what is called the reimbursements again. The Inflation Reduction Act opened up a pool of federal money that went to all the states that participate in this to help reduce premiums during COVID. And again, Inflation Reduction Act. We're seeing those at this moment. We're being led to believe that reimbursement will no longer be available. So the state of Minnesota right now is looking at if you are a family of four making $150,000, you receive a premium reduction credit. So your premiums will be lower. As of right now, as of January 1st, that reduction goes away. And if the numbers are true, generally speaking, across all 50 states, we're looking at about an 18% rate increase just straight off the top. So that's the gross. If we add the loss of those tax credits, it could be in the neighborhood of 35 to 48% rate increase for people. And so how do we look at that as a financial plan? That goes back to the earlier point. If we have a 48% rate increase for a family of four, how likely are we going to be buying insurance for next year for the whole family? Because if the tax credit goes down, that also means those that qualify for medical assistance or Minnesota Care, a reduced premium kind of county plan, in order to qualify for that, the numbers will change dramatically. And so those that have it might not have it for 2026. We have heard, I have no confirmation, I will say that Minnesota, the state legislator, is working on or has set aside some monies to help offset the loss of that reimbursement. But what that means, nobody really knows. And of course, the lack of funding or the lack of money flow, the state of Maryland is suing the federal government at this point. So we are really sort of, on razor's edge. The problem, of course, is that the open enrollment period starts November 1st. And as we take this, it's the middle of September. So, of course, leave brokers out in the wind as much as you can, right?
Wow. Well, and I'd say for Soda clients, and as well, I'm sure you do with yours, we're going to get some notification out. That's tough because it's not just the cost increase. And I think we ran into this with companies with the tariffs. It's not knowing, how do you plan for something that could be 0 to 50% increase? Wow.
Correct. And again, that is, sort of I'll say the inherent flaw or the unintended consequences you said earlier in health insurance, especially as a small business owner or an individual and families. How do I budget for a 35% rate increase that may or may not come? You can't do that. And that, again, is the importance of at least talking to a broker. And I know I'm kind of talking out of both sides of my mouth since I was the one that helped develop the first individual health insurance quoting engine in the state of Minnesota. But that is the drawback of having it all done online to a certain degree. And, we look at the changing in the market and where it's going is I remember very vividly when you could buy your auto insurance online for the first time, right? And auto insurance and health insurance, unfortunately, are becoming very similar in the sense that people just shop the lowest premium without reading what you're getting for that premium. And that's where it diverges, right? Because nobody would ever think that their child is like their automobile, right? If an automobile blows up, you can always buy another one because we bought the wrong property casualty or auto insurance. But you can't say that about a family member. And you need to kind of know the questions to ask when you're shopping for or for health insurance. And the craziest thing about health insurance and health insurance brokers, we're actually kind of free in the whole process. You can come and talk to me. I can get you into any one of the health insurance plans that I offer, and we can pick the right plan. And if you decide to leave my office and go buy the health insurance online, direct with the carrier, you certainly can. The premium stays the same. You don't get a discount to buy it direct. So why not use a broker? We're free in this moment.
Yeah, what's the downside? It sounds like a win-win. You get an expert advice, you get a third party who helps you because you don't know what you don't know and gives you some objective advice. What's the downside?
There, in my opinion, there is none. I preach that from the mountain with every seminar I do with Medicare or individual and family plans is that there are people out there like me that do this for a living. And yes, we do get compensated from the insurance companies, but it's a part of the premium you pay. So again, why pay them the premium? They're not going to come to your house. They're not going to answer the phone call with as much compassion if you have a broker that you like working with.
Yeah, and you're getting professional advice. It's like hiring any professional is about making better informed decisions. And if you're paying the same amount anyway, even if you're not, it's often worth paying that premium for the advice to help prevent something worse happening down the road. That sounds like a win-win.
Correct. Yeah, absolutely.
For someone who is retiring soon, within the next year or two, what should they be on the look for?
Well, depending on their age, if they're retiring in the next year or so and we're 64, turning 65, my advice is to take all the Medicare sales material that they're getting in their mailbox and throw it all away. The other thing they need to pay attention with is Social Security will start reaching out to them, but they only reach out via mail. They do not reach out via phone or email. So if you get a call, which there are plenty of those calls happening that say they're from Medicare, hang up, because they will only communicate with you via mail and then require you to call in. So disregard that. But one of the things you want to look at if you're going to retire is 3 months prior to the first of the month that you turn 65, you need to enroll in your Medicare Part A and Part B through the Social Security website. Okay? Even if you're deciding if you want to work or you don't want to work, or if you want to work even after 65, which some retired guys do, they work part-time and they want to stay in their employer plan, you don't need to worry about that as much. But if you're going to retire the 3 months prior to the first day of the month you turn 65, enroll in Part A and Part B. If you are under the age of 65, contact a health insurance broker within 90 days of you looking to retire early or to make that next kind of life step in maybe a second career. That will give enough time for both you and the broker or whoever you're talking to for advice to get your ducks in a row, because you have 63 days prior to the first day of the month that you need coverage, and then you have 90 days after you lose coverage in order to backfill, but you might go uninsured for a while, which we don't want.
No. Given the kind of costs that you talked about, I don't think anyone would want that. And I know this is a complicated topic, but can you tell folks who might not be aware, what is the difference between A, B, C, and D?
Sure. Original Medicare, as it's most commonly referred to on television and radios and the mailers, is Part A is coverage for hospitalization. When you turn 65, you get what's called Part A, and there is no premium tied to that if you have worked or your spouse has worked 40 quarters over their lifetime. So 80% of your hospital bill would then be covered by Part A. So if we go back and if my daughter was 65 at the time, we would, and we only had Part A, we would be responsible for 20% of $1.2 million, right? Still a big number. Part B is also the other part of original Medicare, which you would sign up through socialsecurity.gov. That covers the remaining 80% of everything that's not the hospital. So ambulance, emergency room, doctors, urgent care, minute clinics, those types of things. It also includes drug coverage for any drug that is administered to you via a doctor, hospital, or clinic. So if you have dialysis or you need infusions or transfusions, Part B covers that, okay? Part C is where a healthcare broker or healthcare agent would step in. It is an insurance plan sold by private companies that cover the remaining 20% of Part A and Part B. And there's, hundreds of ways to get there. And it's unique and individualized as it can be for everybody. And then Part D, as in dog, is the prescription drug coverage. And so you can get that either as a standalone drug plan or as a part of a Medicare Advantage plan. But Part D, as in dog, covers prescription drugs, anything that you give yourself or you go to the pharmacy or is mailed to you via one of the many mail order pharmacies now. And Part B, going all the way back to the beginning, comes with a premium that is income related. Okay, so if you make over a certain threshold, then you will have what's called an IRMA or an income related adjustment. Again, part of your overall financial plan. My Part B premium, the average Part B premium in Minnesota as of today is around $190.74 per month. Could be higher or lower depending on your income. Now, here's a little trick for those of you financial planners. If your clients are retiring and they have lots of employee stock, please take that into consideration, because what you don't want to have happen is cash all the employee stock on the same day, because guess what? Your income goes up tremendously, and the Part B premium then would reflect that one-time adjustment.
So it's not just the higher tax and jumping tax brackets. You have this hidden tax, for lack of a better word, in IRMA.
Yes, that's correct. And now be very clear that if it's a one-time event, a broker like myself will explain to you how to appeal that to Social Security, and you generally win a little bit of a reduction, but not an entire reduction. And they look back every 2 years. So eventually that large sale will then drop off, and then you'll come back to the norm.
So if you're trying to plan for this, you have to plan 2 years in advance.
Yes. You have to plan 2 years in advance.
It's kind of like prior with FAFSA, college need-based aid.
Correct. Very similar to that. And then Part D, as in dog, has an income-related adjustment too. Again, it's all income-related, and it's a 2-year look back. So,
for these adjustments, are there phase-outs, or is it just a hard cliff? If they cross over a little bit, is it a big deal? Is it a big deal?
No, it's a hard cliff to start, but then again, after 2 years, if the income is adjusted back to normal, then it will float back down.
Okay. Excellent. Matt, what is probably the biggest mistake that people make when choosing coverage?
The two biggest mistakes are A, they shop on premium. That's the flat out the clearest one. Then the next one is they don't check the plan that they're looking at's network. Very few people have all their doctors or clinics in the same network anymore. And what will end up happening is they see the first doctor that they kind of see the most is in network, but the one they see the second most, usually the specialist, is the one that's not in network, which leads to greater out of network, expenses, which is always the shocker when we get that bill, because we have to pay that. It's really just kind of being network aware. The other thing is, and it's not as important because it usually jumps out at you, is what the max out of pocket is. The lower the premium you pay, the higher max out of pocket, you can have. And those are the hard ones. Some of us are of the age that remember how great HSAs were, except HSAs generally don't really mean anything until you have about $10,000 or $15,000 in them, because max out of pockets were $10,000 or $15,000, and people would buy the HSA because I have, the premium's low, but we can only fund our HSA to $4,000. And then they say, I never get to use my HSA. Well, there's a reason why, right? And so there are plannings and reasons why to use an HSA. Again, people don't understand that health insurance is far more financial planning and numbers than it is just where do I get a shot or where do I go because I have the sniffles, right? It's more complex now, just like financial planning is more complex.
Yeah, more and more I view it as being a little bit like college planning. 30 years ago, if you didn't plan for college, it wasn't that big a deal because the cost of it relative to everything else, wages, affordability, wasn't that big a deal. If you made a mistake, it wasn't life altering. Now it seems like, same with healthcare, is if you make a mistake, it is life altering.
Yes, absolutely. I mean, you and I both remember the days when all we had to do was work a full-time job during the summer and we had a year's worth of college and, walking around money paid for. Those days, like we said, are long gone. The same thing is holding true. The cost of healthcare is causing, increases in premiums. We're also looking at the fact that the big, beautiful bill took away the ability to negotiate some of the more expensive drugs like we had during the previous administration. This is all causing upward pressure on premiums because, again, our population is aging. We just talked about it, right? That the largest class of baby boomers are aging in for the next handful of years. We get sicker quicker. It costs a lot. I mean, again, I'm talking about our beautiful 18-year-old daughter. She's a $23 million baby. Worth every penny of it from my perspective, but I'm going to say the insurance company doesn't think so, right? So
No, absolutely.
It is. It is an overall financial plan, and it's knowing what questions to ask and not to be afraid, right? It's really there is no dumb question in financial planning. There is no dumb question in healthcare planning, and that's what it is, planning.
Yeah. Yeah, and it's not just you'll put yourself in a better position to succeed, which is more critical now for things like college and healthcare, but it would also relieve some anxiety. And this is where talking to a broker like you is, even if you didn't change your course of action, you're going to have more confidence moving forward. You don't have this hanging over your head.
Yeah, it's a story I like to relate. I had an uncle of mine passed away a few years ago, and I remember a conversation with the lawyer that he worked with his estate. He was a single guy, lived in New York City and around the world for most of his life. But the lawyer had said this was the cleanest estate he ever had because my uncle put the work in to basically have the whole estate to be distributed with ease. It was basically the easiest thing to do. It was clear-cut, well-defined, and everything was laid out. He did the homework early. That's sort of how I envision my role, like you envision your role as a financial advisor, is let's do the homework now while we can. Yeah, we're going to tweak it, but all the heavy lifting, again, is done. And that is the greatest gift you can give yourself and your beneficiaries and your children and your family is ease, right?
Absolutely. Yeah. I mean, in the case of estate planning, yeah, it depends on how much do you want your wishes carried out and how easy do you want it to be on your beneficiaries? And in the case of what you do, it's do you want to go into retirement either kind of ignoring or worrying about could something bad happen? Even if you're in a good spot to not know, to simply say, I have no idea if what the possibilities are as far as a large healthcare bill.
Right. It's a line I use more often than not in the Medicare space is that I will make sure that I make you pay $1 more a month to get coverage I know you need, rather than having you pay $5 less for everything I know that you're going to need and that you're not going to get, right? Because that's what happens when I pay $5 less. I don't get everything I need. I just am touching what I can. I'm only covering what I can touch, but there's so much more to our lives than we can even ever imagine when we come to healthcare.
Thank you, Matt. This has been great. Before we let you go, and thank you again for your time, and you're going to help a lot of people with this information, is what's the one key takeaway, the one key message you want retirees to take away from this conversation?
I think the one key message to start everything would be is you're not alone in this. Again, you're an early retiree or you're a retiree, you're in the largest class of baby boomers. So there's a lot of people around you that have either gone through it or are thinking about going through the same things you are. There is a dearth of information out there. Sometimes it's credible, sometimes it's not. But don't be afraid to ask questions. A good starting point is socialsecurity.gov or medicare.gov are two reliable resources. I use them daily. Don't be afraid to call a broker, look up a broker, or call an insurance company that maybe your group health plan. If whoever that is, they will they will sell Medicare. Call them. They have seminars. I do seminars at least 2 a month, every month,
Okay.
sometimes more. Other brokers like myself do what's called Medicare 101 seminars, where it's just general knowledge. And I'm focusing those in marketing to 55 and older because, again, it's a long-term plan. It's not we just turn it on tomorrow. But if you're asking questions and to yourself for sure, then you're doing right. If you're not worried about it or not thinking about it, then you need to ask yourself what's wrong. Because that's generally when everything falls apart at this point. But don't be afraid to ask questions. We told our kids that growing up. No questions too dumb. Don't be afraid. I'm reasonably educated, and most of my clients are even more educated than I am. And we learn things from each other every day. It's a fast world out there now. I don't have to tell early retirees that. Ask the questions. Do not be afraid. But that's really kind of the message I'm trying to preach here. There's people out there that can answer those questions for you.
Yeah, and it sounds like you're well qualified to do that. I often think in terms of what you do and what we do is there is a lot of information out there, but separating the wheat from the chaff can be really, really hard and time consuming. You could make it easier.
Yeah. I say this with tongue in cheek. I generally go through 25 hours every year of continuing education and constant learning as a requirement just to sell Medicare. I have to get certified every year, not only at the government level, but at the insurance carriers level as well. So we're learning constantly about an ever-changing world. And let me use those 25 hours annual to cut 25 hours off of your life. Can I interest any early retirees in an additional 25 hours? I'm sure I could,
Well, it's not just 25 hours. I look at like with my sons in their cars or stuff around the house. There's not a lot I can't do, but what takes a professional an hour will take me about 3 days and a very angry wife.
Yeah, no, exactly. I mean, it's a line that I have often uttered to a person who works for one of the larger health insurance companies here when they come in to talk to me, and I remind them that I can charge $225 an hour for a financial plan if I build one, if they take it somewhere else. And I say to those clients, to that gentleman, is my Medicare clients, their hour is worth more than $225 an hour. And they kind of shake their head at me, and I say, in theory, they have less hours on this earth than I do. And so that's a valuable hour. I don't want them wasting time figuring out what you guys are trying to provide them. That's my job, to save them that hour.
No, absolutely. No. And if you're going to have a healthy and wealthy retirement, you need to spend your time doing other things than sorting through Medicare literature.
Correct. Let me do that. I've got a lot. I feel like I have a few more years left in me. I'm good to go.
Absolutely. And if they want to get in touch with you, we'll include all your information in the show notes. Where can they do it? Do you have any seminars coming up? How can they engage you?
The best way to engage me right now is I do not have the seminars fully booked yet for this upcoming fall season. They can reach me at matt@contigoCap.com, my email address, or they can reach me at 952-697-2577. That's my direct line. You can skip my administrative assistant, get right to me. That is the service I will offer to you guys. And then we have a website, ContigoCap.com. That's more focused generally towards our financial planning side of it. But if you click my face, it will take you to me and the benefits side of the business.
Fantastic. We'll have that all in the show notes. and Matt will throw in anything else and maybe some other things that will be of help to our audience. Thank you, Matt. We appreciate it. Thank you for joining us.
I appreciate the opportunity, and good luck to everybody. Call.
And if you take some time to engage someone like Matt to where you're making better healthcare decisions, you're going to have a healthier, a wealthier, and a happy retirement. And don't forget to hit subscribe. Thanks for tuning in. If you enjoyed this episode, make sure to hit subscribe, leave a review, and share with your friends. Share the love. Make sure they have a healthier, a wealthier, and a happier retirement as well. Also, don't forget to subscribe to our newsletter for free resources and check out our website and social media pages for exclusive content and updates. See you next time.
Sona Financial, LLC, DBA Sona Wealth and Sona Wealth Advisors, is a registered investment advisor with the state of Minnesota. All views, expressions, and opinions included in this communication are subject to change. This communication is not intended as an offer or solicitation to buy, hold, or sell any financial instrument or investment advisory services. Any information provided has been obtained from sources considered reliable, but we do not guarantee the accuracy or completeness of any description of securities, markets, or developments mentioned.